Hi, my name is Evelyn Breville. My presentation today is going to be about rubella. Rubella, also known as German measles or Tweede measles, is caused by the rubella virus, which is a member of Togavirus family, genus Rubivirus. It typically occurs in the spring, and humans are the only reservoir. The incubation period is usually about 2 to 3 weeks. How rubella is transmitted? Rubella is usually transmitted by direct person-to-person contact, transmitted by airborne droplets from the respiratory secretions of an infected individual. It is contagious a week before and after the disease. Rubella is also transmitted from mother to fetus, which is called vertical transmission. Fetal infection rates are as high as 81% in the first trimester, 25% in the late second trimester, 35% from 27 to 30 weeks in the third trimester, and nearly about 100% for fetus exposed beyond 36 weeks. Since the introduction of rubella vaccine in 1969, rubella cases have been declining in the United States. In 1969, they had about 58 cases per 100,000 populations, 0.45 per 100,000 in 1990, 0.1 per 100,000 in 1999, and in 2015, rubella has been declared eliminated in the United States. For the prevalence, we have globally about 100,000 babies are born with congenital rubella syndrome each year, and that was in 2064 in the US. 12.5 million pandemic cases were enregistered. From 2005 to 2011 in the US, we have about a median case of 11 cases each year, and 42% of them are from immigrated women who came from other countries. And for the first 5 months of 2019, they had only 971 cases. Complications from a rubella infection may include polyarthritis that can occur 1 week after the rash, tensinovitis and carpal tunnel syndrome, thrombocytopenia associated with purpura and hemorrhage, post-infectious encephalitis, myocarditis, pericarditis, hepatitis, and hemolytic anemia and hemolytic uremic syndrome. From 1985 to 1992, the mortality rate in the United States is estimated to be at 0.2%. More than 300 children die every day from measles worldwide. In 2018, more than 140,000 people died, and most deaths were among children under 5 years old. Pregnant women exposed to rubella may have asymptomatic infection, and they are at risk of spontaneous abortion, preterm birth, stillbirth, and low birth weight. The fetus may be at risk for fetal death, low birth weight, fetal infection, stillbirth, intrauterine growth restriction, cardiac anomalies, and hepatosplenomegaly. Exposed to rubella infection during the first 16 weeks of pregnancy put the fetus or neonate at risk for congenital rubella syndrome, CRS. This includes hearing impairment, most common manifestation of CRS, cataracts, eye defects, cardiac anomalies, hepatos and splenomegaly. Later on, the child is at risk for intellectual disabilities, autism, progressive encephalopathy, and diabetes. Subjective presentations of rubella infection may include low-grade fever, pertussis, conjunctivitis, coryza and cough, headache and malaise, sore throat, and polyarthralgia. And these symptoms may last about 1 to 5 days. Objective presentation can include lymphadenopathy in the post-auricular that may last about 3 days, deep cervical lymph node, also 3 days, sub-occipital lymph node for 3 days, and at the end, the maculopapular pink rash that begins on the face and spreads through the trunk and then the extremities that may last also about 1 to 3 days. Diagnosis test. The polymerase chain reaction analysis, PCR, is run to test specimen from nasal and throat swab, from blood, urine, and cerebrospinal fluid specimen. And the test is interpreted as follows. If IgG is positive and IgM is negative, the individual is probably immune to rubella. If IgG and IgM are negative, it is recommended to repeat the test in 3 to 4 weeks from the time of exposure. A fourfold rise in IgG titer is seen when the specimen is drawn between acute infection and convalescence. IgM is positive with low avidity, and a rise in IgG is a sign of acute infection. IgG and IgM are both positive with high avidity. It's a false positive or reinfection. Polymerase chain reaction analysis can also be used to identify in utero infection by either of these methods: chorionics, villus sampling, amniotic fluid, and fetal blood sampling. In case of congenital rubella syndrome implications, the woman should be counseled about either continuing or terminating the pregnancy. And for those women who decide to continue the pregnancy, immune globulin can be offered, not to mention that its effectiveness in preventing transmission to the fetus is unknown. Supportive care and symptom relief is usually the mainstay management of rubella infection. Patient can receive acetaminophen for pain, and glucocorticoids and platelet transfusion. This is reserved for patients with severe case of thrombocytopenia or encephalopathy. The prognosis in pregnancy is usually excellent. Who should get vaccinated against rubella? All children between 12 to 15 months and 4 to 6 years should receive rubella vaccine in conjunction to measles and mumps, MMR. All adults born after 1967, all postpartum non-immune mothers, and it is recommended to rescreen for rubella immunity 3 months after vaccination. The contraindication for rubella may include if any woman is planning to conceive within 4 weeks, during pregnancy, in the presence of febrile illness or immunodeficiency disorder, and in the presence of any history of anaphylaxis to neomycin. How to prevent rubella infection? It's just avoid exposure to rubella, and women must check rubella immunity status before becoming pregnant, and adherence to vaccination in postpartum if non-immune, awareness and adherence to childhood vaccination. All children from 12 to 15 months and 4 to 6 years old must be vaccinated. And those are my references, and thank you for listening and watching.